Doctors of Reddit, what is your most surprising I can't believe I need to have this conversation with an adult story? While on dermatological rotation, a Middle Eastern patient saw me with what she described as some funny, itching growth in her butt crack. Some quick investigation revealed it to be a severe case of genital warts. I explained the diagnosis and that it was an STD until she shockingly assured that she was still a virgin. Now virginity is a big issue for young Muslim women, or perhaps their families even more, but apparently that doesn't cover riding backdoors and therefore no birth control in the form of, say, condoms was needed. I thought I'd share another story, but this time with a colleague being the one acting stupidly. This was when I finally made it to neuroradiology, and in comes this mother who's maybe 3-4 months old son we would scan today because he had epileptic seizures after his birth. Apparently, the pediatricians didn't tell her about the fits nor the severe neurological birth defects they knew about for weeks, so I had to explain her that her child had mental disabilities. That was probably the first time I flipped out on a colleague I didn't even know over the telephone and, in the heat of the moment, wanted to find this idiot and spit in his face. He was totally oblivious of how he fricked up, saying there was a language barrier while this hospital employs a whole department of translators just for such cases. EMT here. I had a grown adult try to explain to Emmy that someone else crap his pants. It got toned out for finger pain at a homeless shelter at 0200. We get there and the guy jumps in the truck with very mild swelling to the tip of his right index finger. Here's how the conversation went. Me. So what happened? Patient. I smoked some M and then I fell asleep in my bunk and I woke up next to my bunk and my finger hurt and there was poop. Me. There was poop? Did you fall in poop? Patient. No. Like in my pants. Me. So, you pooped your pants? Patient. No, it wasn't me. Me. So let me get this straight. You smoked M, took a nap, rolled out of bed in your sleep, hurt your finger, and someone else came along and crap in your pants before you woke up? Patient. Yeah, it wasn't me. Oh my god. Somebody put crap in my pants. My brother is a general practitioner in rural Tennessee. Enough said, right? He says most of his patient visits go about like this. MD well, person, you're pre-diabetic, have high blood pressure, and are complaining about joint pain. Have you been exercising and cutting out sugar and carbs? Person, yeah I have, doc, but it doesn't seem to help. Do you have any better meds you could prescribe? MD well, let's talk about your diet. How much water do you drink a day? Person, I don't like water, so I get extra ice in my sweet tea every day to make sure I get enough water. MD explains how that's not enough water by a long shot. How much sweet tea are you drinking every day? Those can have a lot of sugar in them. Person, well I get a large one from Hardee's McDonald's wherever on my way to work with my breakfast, and another one on my way home for dinner. Then I have a glass or two when I get home. MD well, that's a lot of sugar, and a lot of fast food if you are eating it twice a day. What do you eat at home? Person, I don't like to cook so I usually don't eat anything but Little Debbie snack cakes at home. MD those have a lot of sugar too. Person, I thought that all I had to do was cut out Mountain Dew. Now you're saying I can't eat my food or my snacks. What are you suggesting I do? Eat salads for every meal. Why can't you just up my meds? I'm not a doctor, but my mom doesn't have a good grasp on the reproductive system, so I had to be the one to explain that. 1. Getting my tubes removed did not remove my ability to get a period. 2. That we women have a urethra, a glory hole, and a crapshoot. Babies do not come from the urethra. This one was strange because she had me and my sister, so. 3. That when you neuter a dog, you just remove the balls, not the red rocket too. Taiwan's physical ed was severely lacking, so my mom, until she was in her 20s, believed that if you sat on a seat still warm on the bus that a guy sat in before you can get pregnant. If you kissed a guy, you could get pregnant. I'm still finding out, years later, misconceptions that my poor mother has about reproduction and explaining things to her. Had to explain to an adult you have to brush all the sides of the teeth. Like, no, just the side that shows when you smile is not enough. And yes, flossing is not just a thing for rich people. Had a patient in our high priority area for DKA. Sugar was in the 800s. Stomach pain, nausea, vomiting in the such, pulled Burger King and gummy worms out of his backpack and proceeded to eat them. Like, bro, do you even know what diabetes is? Non-compliance and lack of medical knowledge is a big thing in Detroit. Patient comes in at 2 AM for insomnia, clearly tweaking her brains out. Heart rate 200, can't sit still, bouncing off the walls. I suggest maybe easing up on the C. But doctor, I love CK. I imagine her pulling out a crap load of C at the spot and just ramming it to her nose. I was working in GP and had a patient scheduled for an appointment. Looked through his notes to gain an idea of why he may be seeing me and saw he'd been seen a few times with knee pains, shoulder pains and the like. The guy is in his 70s, so probably just arthritis. I'm thinking I'll do an examination of his sore joints and ask a few questions. Prescribe some painkillers and it'll be a quick one. Call him in and he walks and sits down and is cheery as anything. What seems to be the problem then, sir? I notice you've had some issues recently with sore joints, I ask. He then proceeds to tell me about this sore knee. So I check his knee and take a history and it all seems fine. Ask anything else and he's like, oh actually my neck is sore too. So I check his neck and nothing untoward to be found there either. At this point he's like, okay well thanks doc, I'll be off then. I say to him, oh good, glad we could help. And you have no other pains at all before you go? He then sits back down and tells me he's been having central, crushing chest pain radiating down his left arm and into his jaw since last night and has been feeling breathless, and when it happened he had an impending sense of doom. I know a lot of you won't be doctors here, but I'm sure you all recognize signs of an MI there. He had all the classic textbook symptoms. Called an ambulance and he was rushed to hospital for PCI, percutaneous coronary intervention. Thread a catheter up the arteries into the coronary artery to find and then treat the blockage. Sorry for the medical acronym, haha. TLDR. Man came in complaining of arthritis and when he was about to leave decided to tell me he'd had a heart attack the night before and thought nothing of it. My dad told me about an extremely religious male patient who was concerned about his nocturnal emissions. He saw it as an offense to God and wanted to know what he could do to stop it. My dad's response: well, it's gotta go somewhere, guy. Better out than in, I always say. Nurse here, retired after 27 years on the job. The number of American 20-somethings that don't know if they're circumcised or not is surprisingly high. When one with urinary tract infection symptoms needs to give a specimen for testing, I ask, are you circumcised? If not, I have to tell them to pull back the foreskin before peeing in the cup. The number of guys who have asked, what's that, is way too many. For the record, I can count the number who were uncircumcised on 2 hands. I knew a guy who I'm 99% sure was circumcised who thought that he was not because circumcision is when you cut off the head of the dong. Yeah, no. I don't know how much of this is true. It was my cousin, who is a doctor, who told me he was in his first year in a clinic and people went there to have an appointment because he was good looking. Elder ladies loved him particularly. But this is totally unrelated, and the worst case was when this elder lady goes in with her granddaughter, around 8 years old. She had a severely infected wound in her head. Upon close inspection, he saw the wound crawling with small maggots and the smell was terrible. He was pee, of course, and asked why didn't she wash the wound and brought her earlier. She said she thought it would heal with time and was afraid to wash it, lest water enters her brain and kills her. There was also this woman that took her 6-year-old daughter there to check why she still didn't have pubes. My mom lost her crap when she found out my grandma didn't change her needle between blood sugar tests. My mom lectured her, I lectured her, and she still won't change it. It's like 2 years old. Grandma's gonna die of an infection one day, but that's her problem. Also, she had a friend who didn't know how to use the needle right, so instead of poking herself with it, she'd scratch her skin till she bled. I cringed when I heard that. When I first got diagnosed, they sent me home with lancets and test strips, but no lancet gun. I seriously thought I had to manually stab myself with the lancet. Went out 2 days later and bought a lancet gun. I change lancets for every single test. Most diabetics apparently think this is hilarious. I'm not a doctor, but I suppose this is related. My mother, before she had kids, grew up not even knowing that you could breastfeed a baby. She was never told anything about what breasts were for, freaking, and even about orientations. Her parents never talked about any topic that was considered taboo. My mother learnt about that once she had her first baby subsequently at 16. That is so sad. Lady had a broken jaw. She comes in after 2 weeks with an open mandible fracture. Referred her to the hospital for immediate surgery. She never went BC. It doesn't bother her and she'll see if it gets better. I once had to explain to a friend of mine that fricking doesn't give women curves, referring to breasts, butt, and the curve of their sides. He literally thought that was the only way. This was after he called this little 10-year-old girl a S because she was already starting to develop. So, not a doctor but I work at a hospital. We had someone come into A&E because they needed their nails redoing. They genuinely thought it was a good idea to go to accident and emergency to have their fake nails taken off and redone because they had gotten too long and become uncomfortable. Talk about being high maintenance. Not a doctor, but I have 2 of these stories. First, I had to explain to my 70-year-old grandmother that women's belly buttons have nothing to do with conception. She thought if you didn't have a belly button you couldn't have a baby. Second, when I was in my 20s, a co-worker about the same age came into the office looking distraught. I asked if she was okay. She told me that she thought she might need to see a doctor. After a few more questions she tells me that she and her boyfriend were messing around. He was fingering her when suddenly she couldn't breathe, lost control over her muscles, her heart was pounding so fast, etc. And when it was over she was kind of weak and flushed. She thought it might have been a seizure. I got to inform her that she had an orgasm. Not a doctor, but when I was in Afghanistan a local man came up to us on patrol with his hand wrapped in a sheet. He was in visible pain and was asking for a doctor, so we got the medic to go see him and I helped unwrap his hand and it was just freaking huge. He'd cut his hand very badly and, for whatever reason, kept it submerged in diesel for 3 days before seeking help. His hand appeared to have soaked up a crap load of diesel, or it was just infected to frick, but it resembled a water balloon and lightly touching it caused it to pee liquid. It was nasty. There was a nursing student I had once who laughed loudly and exclaimed, "How can you possibly get an STD in your mouth? Are the innocence of youth." Wait till she has a patient who has an STD in their stoma. I'm a paramedic. I delivered a baby in the back of the ambulance and placed it on the mother's chest. I asked her what its name was. Can't remember if there was a boy or girl, and she looked at me and said, "I thought you named it." I really should have ran with it, but I was too surprised that she actually thought that. I saw a patient for a follow-up after 3 visits in as many days for asthma. He was from another country, so this was the first time I ever met him. His lungs sound absolutely terrible, but he swears he is taking the inhaler every 2-4 hours with no relief. This raises suspicion to me, as the same meds are working in the air. I ask him to show me how he is using it. He holds it about a foot away from his mouth and does 2 puffs like Binnaker and swallows. I felt really bad. He had never received any education about his illness or medications. My great-grandmother used to do this. She was stubborn and wouldn't take any advice. So instead my family asked me to use mine when I was with her so she could see the proper way. I don't remember if she ever caught on. Working in a rural OBGYN clinic, I told a PT to try vitamin B6 to help with her nausea and morning sickness. She called back a few weeks later and told me that Walmart did not have vitamin B6, so she bought B12 and has just been cutting them in half. Well, I could maybe understand thinking the number is a dosage if you're unfamiliar. At least she can do basic arithmetic. Based on the other stories in this thread, that's a solid milestone. That coming to the ear for a pregnancy test is a very expensive way to do it. Apparently she didn't know you could buy one at the Rite Aid down the block. Seriously, don't come to the ear for a pregnancy test, cause the test results won't be the only surprise you'll be getting. Also, if you have diabetes, that you need to take your medication. No, getting fatter isn't the worst that can happen. The worst that can happen is that you'll die. That's why you're in the ear with diabetic ketoacidosis and suffering organ damage. It's why you're gonna lose your toes. Take your goddamn meds. That taking that weird plant they bought from a pharmacy online isn't 14.324 times better than chemo and doesn't only attack cancer cells because it likes the acid environment in it. I was living in China and taught English on the side to a student whose mother was a physician. This was in 2012, just prior to the London Olympics. The mother wanted to send her daughter to London with a school group to watch the Olympics but has reservations about it. I asked why. She said she was worried that her daughter would catch AIDS from using the public toilets. Yes, a doctor. HIV education and awareness in China is severely lacking, even for educated doctors. Source was Chinese. Chinese as in nationality, not ethnicity. I was that patient once. In my late 20s I was fortunate enough to have never had a boil. Nor did I know anyone who had ever had one, so when I got one under my arm I just assumed it was some sort of sore that would go away. When it grew to the size of a weeping golf ball and became super painful I figured out it was a boil and knew that you fix boils by lancing them. Tried to stab it with my rusty penknife but chickened out and went to the doctor instead. I took my soggy tissue away from the mess in my armpit and the doctor literally jumped back in horror. I now know that boils do not fix themselves and should be immediately treated with antibiotics. I married a pharmacy assistant just to be on the safe side. I'm GP in small town British medical centre. Older lady came into one of the day clinics with a large shopping bag emitting a foul smell. So much so we gave her the special treat reserved for smelly patients of waiting in the doctor's corridor instead of the waiting room. Having received complaints from other patients, said older lady comes into my office for her appointment and sits down, asks me how big the largest poo I've ever seen, as a doctor, was. I demur and explain I don't actually see as much poo as one might imagine, and she proceeds to tell me an epic tale. For the week before her appointment, she'd had the worst case of constipation she'd ever had. She tried and tried, but could not go to the toilet no matter how much olive oil or licorice she consumed. Then, the day before the clinic, she felt the urge and found herself doing the longest poo I've ever seen. It just kept coming, and coming, and coming. So fascinated was she by her enormous poo that she couldn't bring herself to flush it, but picked it out of the toilet, put it in a waterproof shopping bag, and showed her friends, who, she says, told her she must show it to a medical professional, because we'd just be fascinated to see such a large, unusual stool. And then she opened the bag and showed me her poo, which filled it. It filled the entire bag. TLDR. Full-grown adult woman brought in a big bag of her poo because she thought I'd find it interesting. Well, I guess she was right. OMFG. Finally something I can comment on. Well, here in Mexico we have something called social service. Our college education is free in some institutions, so we have to pay for it with 1 year of free work in a rural area. So the first month a woman in her 30s came to consult because she was feeling weird in the mornings since forever. I asked what her symptoms were and she told me that every day she wakes up feeling her mouth dry, and that feeling disappears in about 1 or 2 hours. Well lady, how many water do you drink? 1 or maybe 2 glasses, 1 at breakfast, and 1 middle day. Do you know what thirst is? Yeah, when you drink water so you can pee. So I had a conversation that took 1 hour long about what thirst is and how it feels. Also I had to told her that she needed to drink more water. I don't know what blows my mind more, the idea that someone can't determine that they're thirsty, or that someone can make it through a day on only 2 glasses of water. My sister, who is a new Redditor and hope sees this, is a doctor, and 25 years ago when she had her very first patient out of residency, and this patient refused to allow her to see her breasts, which were sore and needed a mammogram to check out a lump. So sister asks why, and this girl, who is about 30 and single, said matter of factly, "Oh, that's lesbian. We can't do that. It's against the Lord's wishes." She loves telling this story at the dinner table on family gatherings, especially to our religious side. I'm a paramedic and recently transported an idiot who self-presented to the local hospital, who found he was having a heart attack, STEMI, and needed him sent to a bigger hospital for treatment. During my assessment I asked him how long he'd been having chest pain, on and off for 12 months. He tells me, any family history, one of the biggest indicators. Oh, yes. Dad died of a heart attack. Brother died of a heart attack. Both of them first presentation. Stone dead on the spot. No fricking about. So, you have a 12-month history of intermittent chest pain, and a family history of your closest male relatives spontaneously chucking hearties and dying, and you've never got it investigated. Furthermore, the only reason you came to the hospital tonight is because your family badgered you into it. I told him he needed a solid kick in the ass. To his credit, he agreed. Loads of people are like this though, as they tell themselves it's nothing and get on with their lives in the hope it goes away. Instead of hypochondria, you get hypochondriacs who, despite evidence to the contrary, think they're healthy. Not a doctor, but I agreed to pick up my good friend's wife from her pregnancy sonogram. Driving home, the wife tells me she's surprised it's a girl because the last kid was a girl and it's supposed to go boy girl, right? Statistically, that is more likely than many other patterns such as, say, boy girl squid rock. As a paramedic, had a patient barricade his elderly mother and grandmother in the house, threatening to kill himself and them. Eventually he let them out, but still threatened to kill himself. We're all waiting outside. We actually have to park the ambulance a few blocks away until police declare the scene safe. PD calls us on the radio and tells us that they have the patient and we need to take him to the hospital. We drive up and hip out, and here's this 40-year-old man in a bathrobe, with what looks like a paper cut on the inside of one forearm. While calling the hospital to tell them we're on our way, I say patient has a very superficial cut on his left forearm. The patient hears me and goes, "What do you mean superficial?" So I explained that it was a very shallow cut on his arm and that he'll be just fine. He says, "I'll be just fine. I tried to kill myself. I cut my arm and then stopped when it started hurting. That's how I figured I did some damage." I was honestly dumbfounded. So I'm only an EMT, but I want to weigh in here to this conversation. I had to tell a patient with severe pneumonia and the patient's family that you don't get sick, that is, catch a cold, by leaving your skin exposed. The family was vehemently debating me on the fact, claiming that I had no idea what I was talking about because I'm not a doctor. Attempting to explain to them the necessity for a foreign body to enter your system was the most preposterous thing to them. I just want to say to everyone who flooded my inbox with wonderful sentiments regarding the work of EMTs and paramedics, that appreciation makes dealing with the seemingly inexorable chorus of professionals telling us, me, otherwise much easier. My parents always told me that the reason I got sick was because I wore t-shirts to bed. Yes, mother, I got the flu because I exposed my forearms and hands as I slept, not because half the kids at my school were probably off dying from it. I'm a dental hygienist and once was telling a patient after a cleaning that she had gingivitis. She replies with, "I must have caught it from my boyfriend." Had to explain to her that it's because she doesn't brush floss enough. She was 36. I had a patient drive himself to the neurology clinic who ended up being completely deaf, cortically blind in half his visual field, and demented to the point where he didn't know what decade it was. That's honestly impressive. From when I was a resident, working in the living hack that is the Ginny R at a major Florida hospital, woman comes in complaining of missed periods. Hasn't had one in 2 months. Me, "Do you think there is any chance you may be pregnant?" Patient, "No, that's impossible." Me, "Are you active in your physical relationships?" Patient, "Yes, of course." Me, "Do you use protection?" Patient, "Number." Me, "Do you think you might be pregnant?" Repeat for 15 minutes. I swear, we could have reduced the number of visits to that by stapling a bag of pregnancy tests to the door with a sign saying "Think you're pregnant?" Take 1 and tacking a T ultrasound probe to the door with a sign saying "Want a picture of the baby?" We use this to take the ultrasound. I think you're forgetting how ignorant the patients that you just described are. If you stapled a bag of pregnancy tests to the door, your patients would take the tests, but inevitably try to use them by spitting into the tests or shoving the tests into the rectum. Patient made an appointment and brought in his crap in a box. He was concerned about the size of his turd, and if it's normal. All he got from the visit was, "Normal turd. Yes, it's pretty wide." Turd box was set out with biohazard waste. Waste guy thought it was a misplaced package and put it on the front desk. Secretary got quite the surprise that day. Not a doctor, but a co-worker asked about a surgery we had just finished at the animal hospital I work at. The dog had a pyometra, pus-filled uterus, we removed. When I told her this, she looked at me in horror and asked how the dog was going to be able to pee without a uterus. She's 25. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.